Hi everybody, welcome. Today we are doing our Substance Use Disorder and Stigma 101 presentation. My name is Sam Lewandowski and I am a Recovery Friendly Advisor for the Recovery Friendly Workplace Initiative. And I'm also someone who has indirect lived experience with substance use disorder, which means that while I myself do not have a substance use disorder, I have loved ones who have been impacted. Today we're going to be talking a little bit about the Recovery Friendly Workplace Initiative, just a brief overview. We're going to talk a little bit about what substance use disorder is. We're going to talk about stigma and the role that safe language plays in kind of combating that. And then we're also going to end with a brief section on what you can do to support a recovery-friendly culture. The Recovery Friendly Workplace Initiative is an initiative of Governor Sununu. It was launched in March of 2018, and it's really an initiative designed to promote the health, safety, and well-being for New Hampshire workplaces, employees, and also communities. And so we do that more specifically by empowering workplaces to provide support for employees in recovery, those seeking recovery, maybe who have not yet entered recovery, and those like myself who are indirectly impacted on account of having loved ones with SUD, which is another term for substance use disorder. A huge part of our initiative is challenging stigma. So what we want to see happen is that it becomes easier for people to come forward and get the help that they need and deserve. And we've seen a lot of benefits associated with this work, especially encouraging employee retention and productivity. So why should employers get involved with the Recovery Friendly Workplace Initiative? So first of all, we say that employers are already employing those with substance use disorder or those who have been impacted in some way. You just might not know it yet. So actually in New Hampshire, there's an estimated around 135,000 people who are in recovery. And nationwide, there are over 20 million people who have substance use disorder, which is about 10% of our population. And then if you think of all of those who have loved ones with substance use disorder, that number just really balloons. And so also work is where we reach people. So work is where we spend a lot of our time. So if we're not out like running errands or at home, we're usually at work. So if we can turn the workplace into a support, we have the opportunity to reach a lot of people we otherwise wouldn't have. Also, again, there's that direct and indirect impact of substance use disorder. And then one of the biggest benefits that we hear come up time and time again is talent retention. So if people are able to incorporate some of these supports in and retain an employee that maybe they otherwise would have lost, that's saving the business a lot of money and just keeping a great worker with them. Some additional benefits that we might see include things like increased productivity, better employee health, better morale and communication as you start talking about these issues at the workplace, and it kind of paves the way to address other things as well. Better employee satisfaction, they feel appreciated and taken care of. More connection to the community, increased customer loyalty. We've heard stories of both people in recovery seeking jobs at recovery-friendly workplaces and also customers seeking out recovery-friendly workplaces because they think that's something that's really neat and I want to support that. And we expect to see decreases in things like absenteeism, turnover, and impact on families. And so now we are moving into our substance use disorder, stigma, and discrimination section. So first, we just wanted to start with a little bit of context and backdrop. So in terms of the cost of substance misuse in New Hampshire, it's very costly. It costs the state an estimated $2.36 billion annually. And a majority of that at $1.6 billion is borne on the backs of businesses, and that happens in things like decreases in productivity and increased absenteeism. And of course, there's also costs to our medical system, our policing and criminal justice systems, and it doesn't include the most devastating impact of all, which is the loss and impact on human lives. And so just a little bit about opioids in New Hampshire. So in this graph, you can see that there are two different lines, and this shows the rate of opioid-related overdose deaths in New Hampshire. So the red line is New Hampshire, and the gray line is the United States as a whole. And so you can see that sharp uptick around 2013 where the rate almost tripled. That's of course very devastating. There have been a couple of encouraging things that have come to light. In 2018, the rate of opioid prescriptions per 100 people was 46 in New Hampshire compared to 51.5 approximately nationwide. And that's the lowest rate since data became available in about 2006. And the rate of opioid-related overdose deaths in New Hampshire in 2018 was 33.1, which you can see is a decrease from that 2016 rate. And the rate has stayed stable since about 2015. This graph just shows the number of overdose deaths involving opioids in New Hampshire by opioid category. So you can see the blue is all opioids, and then we have a line for prescription opioids, a line for heroin, and a line, that yellow line that really jumps up, is synthetic opioids. And so we saw that big increase. We talked about that tripling that occurred, and that was predominantly due to synthetic opioids like fentanyl. And now a little bit about alcohol use in New Hampshire. So this graph shows the total per capita consumption of gallons of ethanol by state in 2012. So what they did was they were looking at different kinds of alcohol and kind of distilling them down to how much alcohol is in each beverage, so they could kind of compare across beverages. And they were looking at alcohol sales and also the shipment of alcohol. And so what they found was that the national average is 2.33 gallons. It's actually recommended that we have no more than 2.1 gallons a year. And in New Hampshire, that number came in at about 4.65, which is almost 2 times that national average. And some people will kind of ask about the study and say, like, could there be more people buying alcohol in New Hampshire? And that is a possibility, but you can also note that that whole New England region is that darker shade, which is that higher range. In 2014, in New Hampshire, alcohol misuse decreased the labor force by 1.65%. So especially in terms of if there's like a tight labor market, that's really cutting into our productivity and kind of human capital. So now we're going to talk a little bit about the definition for substance use disorder. So this definition comes from the American Society of Addiction Medicine, and they adopted this definition in 2019. So they write that addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. They also note, though, that prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. So just a couple of components to kind of circle back to here. So first is that this is a complex thing. It's not just something that's happening in the brain, it's multifactorial. So there's a lot of factors at play. Another piece to kind of highlight is that people engage in behaviors that become compulsive and often continue despite harmful consequences. So that's actually kind of a symptom of this health condition. And then also just kind of remembering that it is treatable, prevention does happen, and recovery is possible. And then there's another person who says, his name is Raj Mehta, and he says that the main symptom of addiction is the inability to get high successfully. And I really recommend his TED Talk. He's a person in long-term recovery, so it's really great to learn from those voices. And what he's meaning there is, he says, if you're getting high and the police are showing up, if your mom starts crying, if you're starting to develop health issues, it's probably a sign that an addiction is present. And now just a little bit about the history of understanding SUD. So in 1956, the American Medical Association declared that alcoholism is an illness. And in 1987, the American Medical Association and others officially term addiction as a disease. And with that comes the understanding that it is a chronic brain disorder, it interferes with relationships and or work, and it also falls on a continuum. So in terms of interfering with relationships and or work, sometimes people with substance use disorder can kind of maintain one of those spheres of their life, and other times it kind of erodes away at both of them and they can't maintain either of those spheres after a while. And then also in terms of it falling on a continuum, so some people have a very mild form of substance use disorder and they might need little to no treatment or kind of interventions or supports, or they might not really utilize that. And then other people have more severe forms and they might need more kind of that lifelong management and kind of a more intensive treatment, kind of whatever that might look like. And then on the right here, we look a little bit at some groundbreaking work that was beginning to be done in the 1990s on the brain. And so this is looking at a particular type of dopamine receptor called the D2 receptor. And so that's that red cluster in the brain. And so that's the comparison subject. And then on the right, we have the person who had a substance use disorder. And you can see there that their dopamine receptor was greatly decreased. And so what is dopamine? Dopamine is a neurotransmitter. It's bound up in a larger system of reward, memory, and motivation in the brain. And what it does is it basically tells us when we're doing something we need to do to stay alive. So I'm just going to hop to the next slide really quick. So this shows when we do something that's like naturally reinforcing, like eating food, that helps us stay alive, we get a little surge of dopamine. And then on the right, you see that image where someone did an addictive substance and you get a huge rush of dopamine. So the messaging that starts to happen in the brain is that you need to do this to stay alive. And so looking at the brain with the person with cocaine use disorder. So you can see that after they've stopped use, their dopamine receptors are starting to come back, which is very encouraging. And just kind of overall something that can happen in substance use disorder is that those receptors start to decrease, or the brain starts producing less neurotransmitters, or a combination of both of those. And so what that means is that they start needing more of that substance to feel that same level of a high or that same level of pleasure. And that kind of helps get a little bit at that kind of escalation in use and kind of seeking it out despite harmful consequences. And then there's also this element of things that were once naturally pleasurable, such as taking care of yourself, eating, taking care of your young. They start to not really compare, and so people can start not really deriving the same amount of pleasure from that. And so sometimes what we'll see is people then start choosing the substance over themselves and even their loved ones. And so this is just kind of a simplistic view. Again, it's more complex than the brain. We'll talk about that in a little bit, but that's just some of what's going on or can be going on in the brain in a nutshell. And I did want to just read a little bit from the Center on Addiction to kind of wrap up our section on the brain. Sometimes people wonder, do people have a choice with this? And I think that they just frame this up really nicely. So they write that the initial and early decisions to use substances reflect a person's free or conscious choice. However, once the brain has been changed by addiction, that choice or willpower becomes impaired. Perhaps the most defining symptom of addiction is a loss of control over substance use. The good news is that even the most severe chronic form of the disorder can be manageable and reversible, usually with long-term treatment and continued monitoring and support for recovery. So that's kind of part of why we're here today, is because there's all things we can do to help and play a role, and so we want to learn more about how we can do that. And so just a little bit about some of the risk factors for substance use disorder. We mentioned that it's very complex. So genetic predisposition accounts for about 50% of the likelihood that someone would develop a substance use disorder. We also have something called adverse childhood experiences, which are also called ACEs. And so that can take different forms of abuse, neglect, and household dysfunction. So abuse could be things like physical, sexual, emotional. Neglect could be emotional or physical. And then household dysfunction might be having an incarcerated family member, might be having substance use present in the home, divorce, things like that. Just to highlight a really famous study on ACEs, it's called the CDC ACE-Kaiser study. They surveyed about 17,000 people, and they found that each ACE increases the likelihood of early initiation into illicit drug use by 2 to 4-fold. And they also found that the life expectancy of those with 6 or more ACEs was found to be on average 20 years shorter than those who had 0 ACEs. So for those who have 6 or more, their average life expectancy was 60 years, and those who had 0, their life expectancy was 80. So if we're just kind of thinking about this, it's people who've lived some pretty hard lives and have gone through some really tough things. Also, co-occurring disorders is a risk factor, so that would be a mental health condition that occurs alongside of a substance use disorder. Early onset of use, so the earlier and the more somebody uses, the more likely they are to develop a substance use disorder. So a lot of times in prevention, you want to see kind of a delay of that onset of use. Access to substances versus access to services. So how easy is it for me to get a substance versus how easy is it for me to access services to kind of support recovery or treatment, things like that. And also policies and laws. So is it something where I'm able to get the health insurance I need? Am I just kind of punished for it? Or is it more of a supportive environment where I actually get connected to things that will help me address my substance use disorder? And also social norms. So just kind of taking alcohol as an example, so not to pass a judgment on alcohol, but just thinking about how prevalent and kind of common and normalized it is. A lot of times we kind of joke about heavy drinking. There's actually more deaths due to alcohol than all other drug deaths combined. So just kind of thinking about how our attitudes towards a substance can maybe shape how we then go on to utilize it. And then I just wanted to mention a little bit about kind of that multidimensional component of risk factors. And so I just wanted to highlight this concept of social determinants of health, which comes from public health. It's just basically that there are a lot of factors that kind of determine or shape or influence our health outcomes. So that includes things like our economic situation, our neighborhood and physical environment. Is there a lot of violence present? Is there a lot of stress present? Our education, the food that we eat, our community and social context, what kinds of norms and values are held there, and the healthcare system that we have access to. And then there's some additional demographic factors. So in sociology, we talk a lot about the intersectionality of race and ethnicity with things like class and gender. And that's all kind of shaping our health and our outcomes there. In addition to risk factors, there's also something called protective factors. So we're never going to be able to eliminate risk factors 100%, but what we want to do is raise those protective factors up. And so just to kind of touch on some risk factors we haven't yet, so being a child of a parent with a substance use disorder, having a low perception of harm, a favorable attitude towards substance use in the home, using it to self-medicate, or feeling very isolated can be some additional risk factors. And then protective factors includes things like having strong resiliency and coping skills, having a high perception of risk, having that strong parent and child relationship, being able to access mental health and other community services, and feeling really connected to your community. So again, we want to kind of try to foster and build those things. And now we're going to have Drew talk about some warning signs of substance use.